Hi everyone, I'm Dr. Rushali here, and because it's the season, it's monsoon is here. The rains are already here in the first week of June itself, and as usual, as every season it is, the fungal infections are on the rise. So today I'm going to do a two-part series on fungal infections. On one part, I'm going to talk about the medical care, and in the second part, I'm going to talk about the personal care that one is supposed to take in times of fungal infection. Now let us start with the medical care that you're supposed to take. Okay, so now firstly, the first and the most important thing, when you are suspecting that you have a skin problem, whether it is a fungal infection or anything else, please visit a skin specialist, a dermatologist only, to treat it. Do not go to any other doctor or any other specialization for it, because there's a reason why skin specialists are skin specialists, because they specialize in all skin related and hair related disorders. Second is, your dermatologist will generally give you two things for fungal infection. One is going to be a tablet and one is going to be a cream. Okay, now I have seen this in a lot of patients. They are like, oh, I'm taking the tablets, probably I can just skip the creams. Or like, अगर मैं creams लगा रही हूँ तो tablet खाना ज़रूरी है क्या? That's a common question that people generally have. What you have to understand is that the burden of treating the disease is divided equally by the tablets and the creams. So 50% burden is borne by the tablets and 50% burden is borne by the creams. So when you've been given a tablet and a cream, please take both of them. Give both of them the equal amount of importance. Don't choose one over the other कि ये खा लिया तो इससे काम हो जाएगा. No, it doesn't happen like that. Okay. Third thing is, a lot of times a patients, like I tell my patients that you have to continue using the cream for 1 month after the lesions completely clear. A lot of times patients don't take it very seriously. Now what you have to understand is, unfortunately, fungal infections have become extremely non-responsive to treatment, extremely relapsing, as in they get cured and then they come back again. In this scenario, it is super important that when you're taking treatment, and then take it properly, take it exactly how long your doctor asks you to. So if you've been asked to apply the creams for a month after complete clearance, please do so. Fourthly, wash your clothes separately from the rest of your family members. Keep your soap separately than what your regular family members use. If there is a child who's got a fungal infection of the scalp, then you have to use separate combs as well. Okay, that's very important. Nextly, relapse is not so uncommon. Relapse does happen. So when you get a relapse, please go back to your dermatologist and get it treated. Okay. And lastly and most important, do not self-medicate. This is super important. Okay. So that's it about the medical care for fungal infections. The next video is going to be on the personal care. Thank you.